Welcome to Eye to Eye. I'm Camiel J. Today I'm talking with Dr. Caroline Klaver about an intriguing topic, modern threats to the eye. Caroline, as an epidemiologist, you look at ophthalmology on a global scale. What do you consider to be the primary threats for the eye at that level?
Well, for the eye or the population at large, probably that's the more interesting part. So we see that among the young people, the frequency of myopia is really rising quite rapidly. So in Asia, 95% of the 20-year-olds is myopic. In the Western world, it's 50%. So with that myopia and the more severe myopic refractive errors, there will be many more complications leading to blindness. So we've estimated that at least in our country, by 2040, myopia will become the most important cause of blindness. So that's something very serious, I think. Other problems that we are facing is we are having an aging population. And even though the age-specific frequencies of AMD are going down, because that we are having so many older people now, the absolute number of cases will also rise. And that will also, we will also encounter this in our clinic. So those, I think, are two diseases that are serious threats to vision.
And how can we do a better job of screening the major problems, including myopia, age-related macular degeneration, glaucoma, and retinal dystrophies?
Yeah, so that's a good question. If we need more people, we need to have more people screened, then you could very simply think that we need more eye care professionals, or you could invent matters to have eye screening by other means rather than an eye care professional. So I think the latter is going to be a solution, and I'm hinting on artificial intelligence and screening that may be done by image devices that are found on the ophthalmic shops on the street, or people selling glasses. You have an ophthalmic image of your retina, or maybe even the front of the eye, your optic nerve, and there will be an algorithm saying you are at risk for one of these diseases or you're fine to go.
Yes.
And I do see healthcare changing quite rapidly into these kind of methodologies. And if we have this, it will be possible to screen many more people at a large scale.
I know that you're very interested and working a lot on that, as many people are doing. How soon do you think it will be operational?
Yeah, so we already have quite a number of algorithms. What we don't have yet is the practical implementation in our clinics. So we don't have a button yet to push when we're making an OCT that gives the risk profile or gives, the number of lesions that are visible. So that part, creating a workstation that is practical, that also allows to give you a risk estimate and maybe a profile for further clinical management, that part is still missing. And there, the computer scientists need to be much more integrated into clinics. Epidemiologists and clinicians need to be more aware of these possibilities and work together on these kind of programs. But I think right now people are starting these things up. And my impression is within 5 years it will already be a big difference.
Yes, very interesting. It's going to be soon. Caroline, how can technology such as artificial intelligence play a role in this?
Yeah, so as I mentioned, I do think e-health will become much more popular. That people will enter an internet site, fill in a questionnaire, fill in their results from an ophthalmic exam, maybe upload their ophthalmic image, which they will own rather than just the ophthalmologist will own, and they can access all kind of risk estimate sites and see what is the risk for AMD, what is the risk for glaucoma, and get advice for further management. So I think the future will be much more that the health is ownership of the patient rather than the or the caretaker, the doctor being in charge of all the management.
Yes. Thank you for joining us. For more information on this and related topics, please visit us at euretina.org.